Botox injections are very well tolerated. They're performed in the office during a very brief appointment. We use a tiny needle, essentially the tiniest needle we can find, to inject very small amounts of Botox into the muscles that we want to relax. And the Botox injection results in the product sitting in that muscle, softening its movement for a period of 3 to 4 months. I think there are misconceptions that if you have Botox, your face is frozen, or you're somehow wearing a mask that doesn't have facial expression. Botox actually works by a dose-related phenomenon. So if you over-treat someone with a lot of Botox, you can freeze their face. But most patients are just looking for a more relaxed, younger look. And so we treat them with much more moderate doses of Botox. It doesn't change the way a person looks, it doesn't eliminate their facial expressions, they can still express their emotions. It mainly just gets rid of frown lines, crow's feet, which are lines around the eye, forehead lines, dimpling in the chin. It can also be used to reduce lines around the mouth and to slim the lower face in people with prominent muscles in the lower face. So as long as you're treated by an experienced injector, you should be able to achieve a very natural result. The other question we often hear about Botox is, what are the risks? And the risks are really minimal. The most common risk statistically is a small bruise. And if you're going to bruise, it's typically a pinpoint bruise around the eye area if that area is treated for you. As long as Botox is placed in the proper muscle, you won't have drooping of the eyebrows, drooping of the eyelid, any of these other things that you may look online and find and be concerned about. So finding an experienced physician injector is critical to getting the results with Botox that you're seeking. The #1 most frequent request with Botox is elimination of frown lines. We all spend much of our day on the computer. In the Denver area, we're almost always outside in the sun. People wind up squinting and frowning due to those two activities much of the day. And so over time, we can build up stronger muscles between the eyebrows, which can result in furrows or imprinted lines or excess frown lines between the brows. People feel like this gives them a angry or unapproachable appearance, and Botox in a matter of days can eliminate that look from a person's appearance. Other than frown lines, people look to have crow's feet reduced, to have lines in the forehead softened, lines around the mouth reduced, and also facial slimming in people with prominent masseter muscles.